Okay, we're going to move into the next, to our first tech talk, and this will be by Dr. Cesar A.A. He's from Iowa State and from the Veterinary Diagnostics and Production Animal Medicine segment of Iowa State. And his talk will be on economic and production benefit of 2 PRRS MLV doses compared to a single dose vaccination program in growing pigs. So Dr. Moura.
Thanks, Boehringer Ingelheim, for the opportunity for me to come here and present some of my work. I'm a graduate student at Iowa State University, and I'm working with Dr. Linhares. And most of my work at Iowa State is with immunological solutions to control PRRS in sow farms and on downstream on the downstream groups as well. So this study that I'm going to present today is one study that we've been working on the last months, and is the production and economic benefit of 2-dose vaccinations compared to a single-dose vaccination program on growing pigs. Just a little bit of background. We all know that one full dose of the MLV vaccine is efficient to reduce clinical signs, to reduce lung lesions, reduce shedding, to increase average daily gain on infected pigs. And earlier studies conducted by Dr. Reed Phillips, Dr. Dale Ponso, and Dr. Scott D showed that 2 vaccinations 30 days apart was efficient to reduce the spread of the wild-type virus in the nursery and finishing populations. Although we had no information about the production and economic benefit of adding an extra dose of the MLV vaccine. So to answer this question, we conducted this study, and our primary objective was to describe the performance of growing pig groups vaccinated with 2 doses of Ingelvac PRRS MLV as compared to lots vaccinated with a single dose of the same vaccine. Meanwhile, at the same study, we also looked at to identify different patterns of wild-type PRRS virus infection over time on the study groups and compare the effect of the different infection dynamics with the growing pig mortality. So this figure here just illustrates our study design. We had groups of pigs coming from 2 different scenarios. We had groups coming from PRRS virus unstable sow farms and from PRRS virus stable farms. And this PRRS stability criteria is based on the AASV, criteria on a paper published by Dr. Houtkamp in 2013, if I'm not wrong. So we had groups from these 2 different scenarios throwing pigs to single dose groups and double dose groups. So we just follow those groups over time, and we're looking at the growing pig performance. Basically, mortality and average daily gain, feed conversion. All the groups that were on the unstable farms, they were first vaccinated at processing and then received the second vaccination on the first week of the nursery. Groups from the stable sow farms, they were either first vaccinated at processing and received the second dose at the first week on the nursery, or they were vaccinated at weaning and then received the second dose 4 weeks after. We didn't want to change the current protocol that the farms were on it, so that's why we have these different vaccination timings. And at the same time, we're following all the groups by oral fluid samples, collecting oral fluid every 3 weeks So we started at the first week in a nursery, and we're following every 3 weeks, collecting 6 oral fluid samples spatially distributed in a bar to document the infection, to document the infection dynamics over time. So we conducted PCR tests, and then every time that we had a positive sample, we ran orophyte sequencing to differentiate wild-type virus from the vaccine virus. So the statistical analysis, we used k-means clustering analysis to identify patterns of wild-type virus infection. We created different clustering dynamics to define patterns of PRRS virus infection on the study groups. And then we use some Poisson regression models to look at the difference in mortality. So we did that between the clusters, the different cluster dynamics, the infection dynamics, and we also did to compare the single dose groups against the double dose groups. To look at the growth performance, we used the simple linear regression models to differentiate single dose and double dose groups. And we also did a production economic analysis model to look at the benefit of using an extra MLV dose. And this is one simplified model based on the model that Dr. Holdkamp used to update the cost of PRRS. So here are the results. This is the basically the diagnostics that we have for PRRS virus type 2, which is the North American PRRS. This table shows the infection dynamics that we had. So after we conducted the clustering analysis, we defined 3 main patterns of infection, which is the first one is an earlier infection pattern, and then a middle infection pattern, and a late infection pattern. And I think it's important to mention that 93% of the groups were detected with wild-type PRRS virus type 2 anytime in a nursery. So we didn't have any challenge in this study. All the groups were naturally infected, and we can see that this study was conducted in a high pig density area, and almost all of the pigs, all of the groups were wild-type virus positive at some point. Those 7% that we didn't detect PRRS doesn't mean that they're negative, it just means that we didn't detect. So we did the regression analysis to compare the mortality results among the 3 clusters, and I also included the one extra group, which is the group of the groups that we couldn't detect the wild-type virus. So, and as you can see, the groups with no detection had the lowest mortality rate, and from the groups that were infected with PRRS, the earlier the infection, the earlier the PRRS detection, the worse was the mortality. So we did the same thing for European virus, which is the PRRS virus type 1. And here, only 56% of the groups were detected with the European virus. And you can see that we found basically the same patterns of infection. Earlier infection, middle infection, and late infection over here. But here, when we did the mortality analysis, the results were a little different. We see that the groups that were not detected with the European virus, they didn't have a significantly higher, a significantly lower mortality as we would expect. And also, the groups that were detected with PRRS earlier, also they didn't have, they didn't have the highest mortality as we saw on a North American PRRS. So we basically concluded that in this situation here, the PRRS virus type 1 or the European virus was not associated with increased mortality. The driver of the mortality in this study is basically is based on the North American PRRS detection. So, and then our primary objective was to look at the 1 versus 2 PRRS MLV dose comparison. This is a table with the results, the mortality results for the PRRS stable groups. And as you can see, the single dose groups had 7.2% mortality rate, while the double dose group had 6.5% of mortality. There is the p-value is low, is 0.01, showing that this difference was significant, and the mortality difference was about 0.7%. When we look at the unstable flows, there is the effect of the extra dose here is higher. We see that the first dose, the groups that receive only single dose had 20.3% of mortality, while the double dose groups had 15.4% of mortality. And in this situation, the mortality difference was almost 5%. Very, very high effect here of the extra dose in this PRRS unstable situation. So we also did the analysis for average daily gain. And as you can see, the p-value here is really, really high, showing that there was not a significant difference here. And for this study, we didn't include the dead weights. So this might be one limitation or one fact that interfere here on this number. But even for the stable groups or for the unstable groups, we're not able to find any difference here between treatment groups. And we also conducted production economic results, and this is basically one simulation that we did, simulating all these numbers, the revenue and the variable cost numbers, that will be based on the simulation of 20,000 head groups, 10,000 head per treatment. And basically this table is kind of busy, but I just want you to focus here. Just want you guys to see that we did different analysis for a stable situation and for unstable situation as well. And you see on the left side that we had the second dose benefit, which is based on the production benefit brought by the extra dose. The production benefit that I just showed, based on average daily gain, based on mortality and feed conversion. And the second dose cost, the column second dose cost, is the cost of the second dose. Basically, the vaccination cost and also labor costs, right? And if we divide these two numbers, the benefit and the cost, we have the benefit cost ratio, right? And to interpret this number is very easy, because if the number is higher than 1, it means that the intervention, in this case, the intervention was the extra dose, was beneficial. If the number is less than 1, it means that the intervention was not beneficial, right? So here in the stable situation scenario, we see that the benefit cost ratio was 1.11, and it means that the intervention here was slightly beneficial. And on the unstable situation, the benefit cost ratio was about 4.1, showing that in this situation, the intervention or the extra dose, the second dose, was highly beneficial for those study groups. Conclusions here, 93% of the groups were detected with the wild type virus type 2. So sending groups to high peak density area, you can expect that most of the groups, most of the pigs are going to get infected. PRRS virus type 2 detection was associated with higher mortality, and the earlier the detection, the earlier the PRRS infection, the worse the mortality. 2 doses of Ingelheim PRRS MLV on PRRS virus stable and unstable flows was economically beneficial, and the double dose groups had significantly lower mortality compared to groups that were vaccinated with only 1 dose. So the next steps of this study is to better understand the benefit of using a different PRRS MLV vaccination protocols on piglets at positive unstable breeding herds. So we want to better understand the benefit of using this double dose vaccination on unstable PRRS virus unstable sow farms. Yeah, with that, I would like to thank Boehringer Ingelheim to support this study, and I'll be happy to take any questions.
We do have time for a couple of questions, so if there are any, please feel free to ask. Okay, here's one over here. Dr. Yeski.
Yeah. When you looked at the groups and the stable and the unstable, did you look at any of the as far as what percentage of the animals were PCR positive, or did you break that down, or is it just positive, negative, and then serology as well?
For the unstable groups, they had a recently outbreak, a PRRS break. So we suppose that the prevalence would be very high because there was the period between the study starts and the outbreak was short, and we had a lot of clinical signs like aborts, a spike in aborts, increased mortality, piglet mortality. So we were expecting the prevalence in that herd to be high, just because of the scenario, but we didn't do any calculation to understand the prevalence on those groups. And the stable groups, they were positive. They were positive on the processing fluids, winning negative pigs, but with no apparently clinical signs on the sow farms.
Okay, well, thanks a lot, Dr. Moura.
Thank you.
Appreciate it.